Starting your timer, and here
Yes,
is your
ma'am.
question. Right. So if you have read and understood, considering that history taking station, kindly begin.
Hello, I'm Dr. Muhammad, an exam surgical candidate. Today I have been asked to ask you some questions related to your condition. Are you okay with that?
Yes, doctor.
Thank you. May I confirm your name and age, please?
Yes, my name is Nada. I'm 67 years old.
Nice to meet you, Nida. So what's brought you here today?
So, doctor, I don't know. I had some accident where I fell down suddenly, and I don't know. My body was shaking badly, and I had a terrible day afterwards.
I'm really so sorry to hear that. Can you please tell me what exactly happened?
I don't know. It was in the morning. I just got up. I had my breakfast, and 2-3 minutes later, I do not know what happened. I had started having jerky movements, and I think I passed out. After that, I do not remember. People told me that I was shaking at that time.
Okay. When and where does that happen?
I was at my home, doctor, and
Oh,
my person who stays with me, my caretaker, she told me that that thing happened. I do not remember.
okay. Okay. What was you doing at that time?
Sorry.
What were you doing at that time?
I just had my breakfast, doctor, nothing more. I just had breakfast, but before that, I think I didn't sleep properly the day before. This is all
Okay,
what I remember.
okay. So your partner witnessed just that episode. How how is he describe it?
They told that my whole body was shaking, and probably uh, I had a tongue bite because my jaws were clenched, and I had passed. My clothes were also soiled with urine because I lost control.
Okay. Did you trip over or slip?
I think so. Yes.
Okay. When the first time did that episode happen? Did the
Um.
first time?
No, this was not the first time. I had such episodes. I think my last episode was, say, three months ago.
Okay. What did you feel before the episode immediately? Did you have any conscious, fearful?
I think I was feeling I had difficulty in hearing. There was this I don't know, maybe I was hypersensitive to light and to the sound because I was not feeling good just before the episode.
Okay. Did you have any feeling that anything's was going to happen?
I guess yes. I had that feeling.
Okay, sorry for that. So did you lose consciousness during that episode?
Yes, I lost consciousness. That was told by my caretaker. I
Okay,
do not remember. anything.
Okay. Do you know for how long did you lose your consciousness?
They said for maybe 1-2 minutes.
Okay. You said your bite your tongue. Did there's any other movement, right? Like rabbit eye blinking or any other?
They told me there was uprolling of the eyes.
So this was deviated to one side.
I'm not sure if she noticed because
Okay. Is there
not
any
sure
was
about
any? Is there any was lip smacking?
this is, yes, I guess they said that I was doing some abnormal or some different movements during that episode, and yeah, I guess lip smacking, I was doing it.
Okay, you said that you had wet or soil your clothes.
Yes.
Okay. Does all of your body was shaking or just part of it?
All of the body was shaking.
Okay, sorry for that. So what did you feel both immediately after that episode? Did you have any confusion, drowsiness, or you was unable to speak?
I was able to speak, but I think I had difficulty recognizing people and the place because when I woke up, I didn't know where was I. I was completely blank, and it was after I had some sleep that then I could remember the episode.
Okay, sorry for that. After how long did you regain your consciousness? Is it that 4 minutes?
That was for probably just 1 or 2 minutes, not more than
Okay.
that.
Okay. So have you had this episode before?
Yes, doctor. 3 months ago.
Okay. So do you have any throw up or you vomit?
No, I didn't throw up.
Can
Okay, did you
you
lose
summarize
weight?
your history now?
Okay. Before I present the case, if time would allow me, I would like to ask about systemic review and post-ictal manifestation and also sign of increase intracranial pressure and
Okay.
also ICE, idea, concern, and expectations.
Good. So what was the history today?
67 years old male, female, presented with generalized tonic-clonic seizure lasting about 1 to 4 minutes, and also there is no post-ictal manifestation and it's hypertensive.
Okay.
And also there is uprolling of the eyes and
yes, and she soaked her clothes, and there was tongue bite and there was no vomiting. So what are your differential diagnoses for her?
Yes. It could be epilepsy or meningitis or encephalitis, or it can be due to brain tumors.
Yes.
Or TIA.
How would you confirm your diagnosis?
After taking the history, I will examine the patient.
Yes.
Then I will order some investigation like routine CBC, urine electrolyte, such as calcium, magnesium.
Yes.
And also I will ask for CT and MRI to see if any intracranial hemorrhage or brain tumors.
Okay. And
also I will ask for EEG electroencephalogram.
Okay. What are the treatment alternatives that you can offer
and
her?
Okay, if she's sneezing, I will move the patient to the quiet place, safe place, and left lateral position, and also I will start doing ABCD approach, cure the airway and breathing and the circulation, and observe for any abnormal movement and the progression and the duration. If it's not to stop, then I will use some benzodiazepines such as diazepam.
Okay.
IV 10 to 20 milligram or phenobarbital 18 to 20 milligram IV. If patient regain consciousness, then I will go for oral tabs such as phenytoin
Yes.
or phenobarbital.
And if it turns out to be, yes, carcinoma, then?
If it is tumor, then we'll go for biopsy and surgery.
Discussion with MDT, neuro oncology, and then you
Yes.
do the, yes, and resection or debulking. Okay, very good. Thank you. Good, thanks.
Thank you.
Yeah, see, now that you're becoming professional in cooking history, you have realized from yesterday or 2 days, you cannot finish it because now you're realizing how much you have to ask. So would you give feedback first, Dr. Nida?
This patient.
Ma'am, I think he did ask the pre-ictal more.
Yeah.
Yeah, he did, but he was not focusing on the post-ictal. He asked few questions twice.
Yeah.
Like the episodes and the timing and the auras if the patient was having. So he was very much into the just focusing on the seizure and not the post-ictal or the past history or so, because we didn't even reach there.
We couldn't, yeah. But that was very good. Both of you were good. Even the way you were answering,
that was definitely good, because it's a very it's a very difficult history, ma'am. These are some of the histories I feared. Yeah, this is one of the history I fear.
She was
Sorry
very
for
cooperative.
interruption.
No, that's okay.
Yeah, it came in Khartoum, 2019.
Yes.
Oh my God.
Okay, and then yeah.
Last
then
exam that held in Sudan.
Right. Yes. Good. And her help
just
was
want to
also
ask
professional.
if,
yes, please.
Yes, she was good and she was confident.
Yes.
And just one patient I think she was giving more details. Should I ask the question just to confirm that the examiner that I am saying, or no need?
No,
if in exam, if your actor or is answering more than you want, you have to very politely bring the actor back on the road and ask the questions that you want her to answer, because you have to rule out if it's in exam, it's basically seizure, it's not epilepsy. But then epilepsy is also one of the differential diagnoses that you have to keep. It's actually seizure because of the patient has brain tumor, 67 years old. She's not going to have an episode of epilepsy now out of nowhere. So there has to be brain tumor. So you have to keep that in your mind, and then you have to ask questions accordingly so that your examiner can hear that you're ruling out seizure, you're ruling out epilepsy, you're ruling out brain tumor. So you had to ask the associated questions, that if you wake up and have you ever had a morning vomiting or morning sickness, how you felt. So I know towards the end you were getting at appetite and weight loss and all those, and even you asked about the history of vomiting. But then morning sickness is important. If they wake up, how they wake up and how they feel during the day. Do they feel tired during the day, or they feel tired in the morning, and then by the end of the day they feel they become active? So you have to ask questions accordingly, so that examiner can see that you're ruling out your differential diagnosis. And at the end, when you're mentioning your differential diagnosis, it all should make sense. They should all be like one bead after another in the thread. So they should all be together, like connected. Good, very good. Thank you, both of you.
Okay.